Active range of motion is what positions our athletes are able to get into under their own control. Passive is which ranges they can achieve with assistance. For those with mobility impairments, there is often a larger discrepancy between the two. This could be due to muscle weakness, spasticity, contractures, or other anatomical factors. But function remains the same. Glute min and med are responsible for abducting the hip, the quadriceps extend the knee, the hamstrings and glute max are responsible for extending the hip, and the iliopsoas flexes it. We are constantly exploring how we can place our athletes in better positions to strengthen these muscle groups at various joint angles. If an athlete is able to transfer from their chair to the ground, we frequently use supine, tall kneeling, and quadruped positions to train the lower body. Here we'll test Sam's active and passive hip flexion range of motion in a supine position. Laying on his back, he'll hug one knee to his chest. This is his passive range of motion. When he is instructed to let go and try to hold the knee in place, we see where his active range of motion lies. Sam demonstrates an ability to isometrically hold his knee close to 90 degrees, which indicates to me that he has the range of motion to achieve a parallel squat if there weren't other factors in play. We can strengthen this active range of motion by placing a mini band around his shoes. This will help him train hip flexion and has had a favorable carryover to his gait when pushing a sled. We can also assess hip flexion in a quadruped position. Here you'll see that Sam maintains a neutral spine as he shifts his hips back. If we observe butt wink at the end range, then that would not be considered true hip flexion range of motion. And if I were to rotate him 90 degrees into a standing posture, this position would resemble the bottom of a squat. Now, if we perform the same action in a bear hold position, we begin to get more of a training effect for the quads. By taking away the demand on the ankle-calf complex that we'd have in a traditional squat, he can get better hip flexion depth. You'll notice that although his hip and knee alignment is favorable, his foot position wouldn't be conducive to a stable freestanding squat. However, this gives me good insight into how I need to set up his foot position to perform assisted reps. We'll elevate his toes to place him in a relatively plantar flexed position with his left foot turned out slightly. We place a small ball between his knees to improve alignment, and while he may not hit a standard of depth, he reports fatigue in his quadriceps, which is a good indicator to me that we're taxing the intended muscle group. We know from several research studies on CP and gait that the hip abductors and knee extensors at 30 degrees have the largest implications for standing and walking ability. This gives us insight into what our training should emphasize if we want this as a functional outcome goal. We can train hip abduction in either a side-lying or a quadruped position. The setup is important, as is communicating to the athlete that we're looking exclusively for motion at the hip and not compensation through the lumbar spine to achieve a greater perceived range of motion. The previously mentioned squat pattern will address knee extension, but we can also use seated leg extension exercises with an ankle weight to isolate the quads. This is one of the scenarios where we see his active and passive range of motion differ. When performing a rep, I can provide a bit of assistance at the end of the movement to help him into a greater range of motion. We'll use a similar strategy when having Sam perform hamstring curls in a quadruped position. He'll use his hamstring to lift his heel up, and once he reaches the limit of his active range of motion, I'll assist his foot a bit further. At the top, I cue him to resist as his foot lowers back to the ground. Even if Sam is unable to actively access these ranges due to contractures or muscle weakness, we hope that creating strategies to train his joints through a full range of motion will improve strength and reduce perceived tightness. When we look at functional outcomes for our athletes who use a wheelchair, lower body strength and range of motion is only one piece of the puzzle. We'll still prioritize cardiovascular conditioning, core and upper body strength, and shoulder health, as improvements in these areas will have larger repercussions in terms of functional ability and long-term health. But it was pretty cool when Sam finished this session the other day by saying, "Check this out," and then stood up out of his wheelchair. It means we're making progress, and it's a nice reward for his hard work.